tests. These are urine tests. So the two different tests that I'm going to show you how to go through today is the neurotransmitter testing, and this is to see different neurotransmitter levels in your brain. The best way to test is through urine. And I'm also going to go through, it's called urine metabolites, but what we're testing is for your estrogen levels and your estrogen metabolism. So also done through urine. Essentially, how you take the test is identical in both of them. So I'm going to show you through one kit how to take it and then add little notes and whatnot. So inside your test kits, you're going to have a requisition form, which looks like this. For both of them, you're going to fill out any highlighted area on the form. So for the neurotransmitter testing, you have this area on top, which is your name and address. It's also an area of symptoms. You're going to fill out all the symptoms that you do have. For things neurological, it could be stuff like depression, anxiety, problems sleeping, like brain fog, things like that. On the back of the form, this region on top is going to be any medications that you're taking. So for neurotransmitter testing, if you happen to be taking any sleep aids or medications that help neurologically, or things for like depression, anxiety, any type of bipolar, those type of psychological medications, we want to have it listed on here for sure. And we also want to be off for a minimum of 1 week. If we're taking these medications, it will affect your levels on the test. So make sure with your doctor and with Dr. Norette that we're on the right schedule, not being on the medication and testing. So we're going to put the medications that we're taking, the dosage amount, last time we took it, and the time. And then down here, we already pre-selected the neurotransmitter testing that we're testing for. In the test kit, we also have a label that will be going on the outside of the bag. The bag that we put the test kit inside and the label right on the front. We also have the form showing us exactly how to take the test. Both tests are for dry urine samples and at the same time, so we'll go through these instructions, and it also shows you right on the back with pictures how to do it. And the last thing in our kit is the bag that we're going to use to get our urine samples. So let me briefly go through with you how to do the samples. So first things first, we're going to take these samples out. They look like this. On the back of each one, before taking any urine sample, we're going to put patient name, date of collection, and the time of collection that you're doing. Now, while you do the sample, we're going to make sure not to touch any areas here, just because it can create alterations in the sample. And essentially, you're just going to dip this side, when I explain to you, into the cup of urine. Okay, and the same comes in the estrogen testing. You have your kit, the bag, label, instructions, the sample, and your requisition forms that you're going to fill out. Only difference on the requisition form for estrogen testing, so we're going to fill out the same. For women who are still menstruating, or if you don't have a cycle, we're going to make sure to fill out that in this area, and then we're going to fill out any symptoms that you feel. On the back of the form, same concept, all medications must be put on here. We don't need to stop hormone medications before testing, so we're going to make sure to have all that here. We're only stopping tests, for the test, the neuro medications. So for both tests, we're going to take 4 urine samples. So by urine samples, it's very easily done. The first urine sample is going to be your first morning void. So this is when you get up, the first time you go to the bathroom in the morning. Then you're going to have a sample that's 2 hours after waking, a sample that's before bed, before dinner, and a before bed. So that's 4 dry urine samples. So I'll show you here on the back. We already pre-labeled all our samples here. So we filled out our name, the date, and the time that we're gonna do this sample. After we fill out that information, we're gonna grab a cup, pee into the cup, and then we're gonna carefully unfold and put this all the way to the top with urine. Once it's fully saturated, we're gonna take this nice little urine sample and put it hanging. An area that you can put it hanging is like on a towel rack. You just kind of like hook it over. It has to dry for a minimum of 6 to 8 hours. So the morning sample, it's only going to be fully dry later on, afternoon, or towards the evening. So we're going to hang it on the towel rack. So I'm going to put that. After we've completed all the urine samples and they've dried 6 to 8 hours, we're going to grab these samples, carefully fold them, making sure they're labeled, and put them in the specimen bag like this. Remember, your last sample is before bed, so it must dry overnight. So we're going to put them in the specimen bag, all 4 samples that are labeled. Then we're going to just double check, make sure our requisition form is completely filled out, especially the time that we take all 4 urine samples right here and the date that you collected, along with the medications that you're taking or put on pause to take for the neurotransmitter testing. Most of the time we also try to help our patients, so we can also print out the form of the medications that you're taking or have this pre-filled for you. So we're going to take our filled out requisition form, put it inside our little kit, our dry urine samples that are labeled with the name and time. We can also include the instructions, close up the kit. The kit goes into the little bag for shipment. We peel off the closing it, and then we put our shipping label right on the front. This kit is sent through UPS, so you go by your local UPS and just drop it off. The only difference that we have for the estrogen urine samples is that this will be done on days 19 through 22 of your menstrual cycle. So that means the first day that you get your period, that is day 1. So you're going to count 19 to 22 days after that, and that's when we're going to do the urine sample. It is the same as the neurotransmitter testing in the sense that we're doing the morning first void, 2 hours after waking, the before dinner, and then before bed. The samples have to be dried, hanging somewhere from 6 to 8 hours, and then all must be filled out, put in our little kit, the same thing, name, date, time that we do our samples in the kit. The instruction form, just in case we forget, with pictures. All in the kit. Then the kit, we're going to open up the bag, place it inside. Close it up tightly and place our label right on the front, just like this. And we will take this to your local UPS as well. If you have any questions, you can call the office, 954-384-8989, and we can help you out that way. Thank you.